Okay, why don't we go ahead and get started? Hello, everyone. Welcome to the last session of the first day of the summit. We're really excited. In this section, we're going to be presenting the 2024 Rising Visionary Award. My name is Dr. Sandra Block. I am the current president of the World Council of Optometry, professor emeritus of the Illinois College of Optometry in Chicago, and a board emeritus member at Prevent Blindness. And I'm lucky enough to be able to moderate this session. I first want to describe myself. I am a short white woman with long brown hair, around 70, wearing a sleeveless top that is black patterns on white with blue and brown reading glasses because it helps me see better, which is what we're all about today. And now I would like you to move to the next slide so I can introduce the award. Okay, so this is the exciting part of the day. I would like to introduce our awardee, Dr. Erica Shelton. She is an optometrist and a PhD candidate at the Ohio State University. Erica was selected as the recipient of the Prevent Blindness Rising Visionary Award. And this award is a pretty amazing award that really looks to recognize whether it's a student or a resident in optometry, ophthalmology, primary healthcare, nursing, or other health professions in the United States who's actually submitted the best overall application and essay in response to a particular topic of the year. This year, the topic was, and I will read this out loud, identify an opportunity in which engaging the preferences, cultural background, and social context of patients and or caregivers in the development of vision and eye health research, programs, or policy can lead to a more impactful outcome. Dr. Shelton's award submission emphasized the significant success of supporting a strong school-based vision program and the importance of providing accessible vision care to the pediatric population. And this also provides opportunities to improve vision health literacy in families and helps to build a culture that appreciates the importance of vision care across all ages. So I would like to please welcome Dr. Erica Shelton to give our closing presentation on progress in children's vision health and the journey ahead. Erica, it's all yours.
Thank you, Dr. Block, so much for that kind introduction. Like she mentioned, my name is Erica Shelton, and I am very honored to be this year's Rising Visionary Award winner. I am a white woman who is around 30, has a gray top on, and dark brown hair. And I'm going to be speaking today on the topic of my essay, which is titled Progress in Children's Vision and the Journey Ahead. I like to briefly just state that I have no financial disclosures, but some of the organizations I will mention in today's presentation, I do work alongside. In order to understand my approach to this topic, I just briefly wanted to tell everyone a little bit about my background. Growing up, I always knew that my future was going to involve children's science and teaching in some way of a career path, and that led me to a career in optometry. I graduated in 2018 from The Ohio State University with my Doctor of Optometry degree, as well as a master's in vision science. And that master's in vision science really taught me to appreciate the scientific method and how much work really went into the evidence-based clinical care that I was using to take care of my patients. Following optometry school, I completed a residency in pediatrics and binocular vision at Ohio State, where this lovely group of doctor mentors really helped excel my clinical management of pediatric eye disorders. And through that time, I started to question a lot about how the vision health literacy space worked, especially with my parents and families and patients. And that led to me working on the PhD that I am now pursuing. And so the last few years I've worked under Dr. Dean Van Asdale, and he has taught me so much about how to apply that scientific method that I learned about during my master's into a public health space. And when you look at public health problem solving, the first step is always to really look at surveillance, or in other words, what is the current kind of situation that you're looking at in the population that you're observing. And so I spend a lot of time looking at where the children who are who had vision impairment are located, and more about vision care access as it relates to children, to better understand what people know and how children are interacting with vision care currently, and then to use that information to hopefully propel health literacy in that space. To make sure everyone kind of understands what I mean by health literacy, there's kind of two different definitions that I work with that the CDC uses. There's personal health literacy, which is the idea that a person has the ability to understand and to obtain and use information to make healthcare decisions for themselves and for someone they might be in the care of. And then organizational health literacy. And organizational health literacy is the idea that an organization that provides health care or health information must make sure the information they're providing is appropriate and that it's equitable in how they are producing it and making it available to those that they are serving. And together, these two entities kind of work together to propel health literacy. And I think this is important to keep in mind as we talk a little bit about pediatric vision care and pediatric vision related public health topics throughout this presentation, just because there's kind of two sides to the situation, right? There's a personal side, but there's also an organizational motivation. So both of those things are important to keep in mind when we're talking about different programs and interventions. So what do we know about pediatric vision health? We know that pediatric vision disorders are costly. And in 2012, in the population under the age of 18, we spent around $5.3 billion in that space, and about 70% of those costs fell on the families. We also know that the prevalence in children and in adults of vision impairment is going to grow in the coming decades. And we know that there's adulthood ramifications of pediatric vision disorders, meaning that people who have strabismus in adulthood do report more mental health conditions. And people who report having pediatric vision disorders in adulthood tend to report more labor intensive jobs. So there are some differences that can last throughout someone's life. And in 2016, the National Academies of Science, Engineering, and Medicine put out a report on vision. And this report had a bunch of information about vision health surveillance. It taught me quite a bit about the vision related public health space. And it called out a number of different research gaps that are out there. And I'd like to just point out a few that I think are important to the pediatric vision related public health space. One being that we need to learn more about what people know about eye health. And this is where we go back to surveillance that I said that I've spent a lot of time during my PhD working on. It's really important to make sure we really understand what people kind of already know and where the risk factors are located, and then how to best intervene. We need to have better interventions to improve vision care after vision screenings. Vision screenings in the pediatric community are very common, as most of us here know, and there is an issue with how we make, or there is issues in how we make sure kids actually follow up with the eye care that's necessary after a failed screening. It varies quite a bit from program to program across states. And then lastly, impact on vision healthcare in daily life. We need to make sure we're focusing on what people value about their eye care. And that varies from community to community. So what is important in your community may be different than mine. And all of those things are important when we're thinking about how we navigate this space, especially in pediatric vision related health literacy, because we're talking about children and their parents. And both of those things play a role here. So what are some of the interventions that are already kind of paving the way and doing a really nice job at this? There's school-based vision programs, there's health access programming, and there's health literacy programming. A couple of examples of school-based programs are the One Sight Vision Center at the Euler School, which is a brick and mortar vision clinic inside of a school in Cincinnati that serves the greater Cincinnati public school area. And it serves as a vision eye health hub. So it's really the kind of home base for these children. It provides their comprehensive exams as well as chronic and acute care. And then there is a national nonprofit organization called Vision to Learn that provides eye exams on a mobile platform that drives around to different schools and provides eye exams and then connects students who need further care with local providers. There's also health access programming that's out there. Couple of examples would be Sight Savers America or Sight for All United. And both of these programs have similar tasks, and that is to reduce the barriers that parents and families face when they're trying to navigate vision healthcare access. So, transportation, scheduling appointments, covering costs that insurance doesn't cover, but they intervene at different spaces. Sight Savers helps in the post vision screening failure space, and Sight for All United helps after a child has visited a mobile clinic and they're in need of more services. And then there's health literacy programming. And a couple of examples are the National Center for Children's Vision and Eye Health through Prevent Blindness, which has obviously, as a bunch of us know here, a lot of great reports and data information for shareholders in this space, but also a bunch of information for eye care providers and parents to access so they can learn more about vision health for their children and for themselves. And then the Save Our Sight program, which is a state program here in Ohio that funds a few different avenues. But the one I wanted to mention today is the Realize program, which is ran by the Ohio Optometric Association. And it has a K through 12 vision health eye curriculum. So volunteers can learn the different lesson plans for the different grades and then take those lesson plans into their community classrooms so they can educate children in their community about vision health. Now, you might notice a lot of these different organizations are similar but different, right? They might both be school based programs, but they might operate a little differently in one situation versus another. And that's important to keep in mind because there is quite a bit of diversity in these programs because every community needs something a little bit different, but there are a lot of similarities between communities out there. So, just important to kind of keep in mind that there are a little bit of differences, and that's important when we're thinking about which program might be best to use and where we need to move forward. So, what do we still need to do? We need more research in this area. We need more research in how well these interventions work. And, like I said, because different communities might have different needs, it's important to make sure we know which programs work and which situations they work best in so we can make sure other people can emulate programs that are best for them. And then we really need to understand more about the why, the value for those we are providing care for. And I feel like this is kind of a theme I've brought up a handful of times, and it's because I'm really passionate about this area. It's important to make sure the care we're providing has a purpose to the people we're giving it to. And so, really understanding and being part of the community in which you're serving is important. And in a research space, making sure we spend time and energy to really understand that is going to lead to successful long term programs in this space. And all of this research is important to implement these programs, but it's also really important to help make sure that we have data to provide when we're advocating for pediatric vision care, which is another really important kind of topic in this area. National, state, local level, they're all important for different reasons. I know today we've heard already a little bit about the Prevent Blindness bill that is in Congress right now, which is great. And at the state level, another example is in Ohio, people have been advocating for pediatric vision care from multiple professional backgrounds for a handful of years. And the governor recently created a children's vision strike force, which has an interprofessional committee that is tasked with how do we move this forward? How do we actually take what's working and what's not working and create a template and a path for different people to emulate to help increase access for vision care for children? Which is really great. And that leads kind of to that last bullet point I have here about the importance of an interprofessional approach. Advocating for pediatric vision care isn't something that eye care providers like myself can do by themselves. It really means that we need a all hands on deck approach of different professionals that play a role in pediatric vision care, a lot of which are on this call today. So, in conclusion, pediatric vision related public health is an important component of the vision related public health field. And we know that it's a growing condition. And if we don't do anything about it, it's just going to keep getting worse. But luckily, we have interventions that are out there. We just need to know a little bit more about them and make sure we fully know the community that we're serving, what they value, what they want out of these programs, and make sure we're adapting them as best we can so that they can gain the vision related health literacy information that we want them to so we can prevent as much preventable vision impairment in the pediatric population as we can. So thank you very much for listening. I just like to real quick acknowledge some of the different mentors that helped me over the course of my PhD that hopefully I'll get to wrap up next year, especially the National Institute of Health Loan Repayment Program. They really help make what I do possible. So I wanted to make sure that I mentioned that. And anyone out there who is an OD or an MD or any sort of medical degree and is thinking about doing research, I highly recommend looking into it if you have student loans because it makes it really, really wonderful. And I'd also like to thank my partner, Kevin, as well as my nieces and nephews, or my nephews and niece pictured here, and my dogs, Carla and Olive. They make everything possible. So thank you. And I have some references and I can take any questions, Dr. Block, if we have them.
So we do have a couple of questions. And first, I just want to personally congratulate you on receiving the award. You have demonstrated that you have the potential to do great things, and I look forward to watching you over the next few years. So with that, I'm going to turn to some of the questions. Some of them are related to what we've heard all day long. Um, actually, I'm going to reword it a little bit to make it a little simpler. So vision screenings are wonderful, and we know that they're important, and we know that that's one of the ways that children are filtered into the program that you deal with, and understanding the importance of it is very important. What are your thoughts about why there isn't consistency in vision screening? And there's no right answer, obviously, but I just, as you're dealing with improving access, why are vision screenings not universally available and in a way that ensures that they get care?
Yeah, I think a large part of that is the time. It takes time to train people properly and time to perform these screenings. So I do think that's a large portion of it. Also, I think it goes back to that value. If someone's going to put in the effort to perform a vision screening, they have to know that it's going to do something on the back end. And I think if I think of school nurses as a common person who is performing these screenings, if they know that they put all the time and energy into doing these screenings, but only, 20% of the children are actually going to get care afterwards, it can lose some of that motivation to want to get it done and want to get the screenings done in a timely fashion. And that 20% isn't something I just made up. Right around 22% is the state of Ohio's reported follow up.
Follow up on all the referrals. My goodness, that's
Yeah.
sad. Very sad. Frustrating, knowing that the kids can do better if they have the appropriate interventions. So with that, bringing up the fact that school nurses are an important aspect of ensuring care gets to the child, what other professions do you think are important to involve in pediatric vision health?
Yeah, yeah. I think my favorite answers for this is social workers. In my experience over the last few years working with different schools, social workers are a really important element to this whole story. And I think that we can learn a lot from them. I can as an eye care provider. And they're really great at navigating a lot of the difficulties that some of these parents may face. And they really understand the communities in which that they're serving. Nurses, like we mentioned, are also very important. Obviously, anyone involved in vision care programming. I think of orientation and mobility specialists, special education teachers are also very, very important, as well as regular teachers, and obviously parents. Sometimes I feel like when we talk about these things, we want to enact all this change. We forget that parents should be at the table as well when we're talking about these different programs.
So with that, parents are oftentimes part of our challenge. They don't understand a paper comes home, or maybe it doesn't actually make it home. Uh, the importance of following up on it. Um, I know that the program that you have in Ohio called Realize that you talked about a little bit. Um, you know, Two questions. Number one, you say it was funded by Save Our Site. Who are they? How does other people get access to those resources? And and then how does it influence increasing that 20%?
That's a really great question. Yep. So realize in the Save Our Site program, Save Our Site is funded by the actual. It's funded by the BMV. So when people in the state of Ohio renew their driver's license and their like registration for their car, you can donate money to help Save Our Site, and you can donate $1, $5. It can vary. You can fill it in, and you can do it online. So it's funded through volunteers in the state of Ohio who donate their money, which is wonderful. And the program, like I said, is ran through the Ohio Optometric Association. I do know that they can help people understand more about the program, but I don't know that it can be used outside of Ohio. You'll have to talk to them about specifics of that just based on how the fundings work. I'm not 100% sure. But what's great about that program is it helps teach the children about eyes, and then it teaches the teacher about eyes and vision health, and then information is then sent home. So it's really hard to measure how health literacy can trickle down from a program like that to being efficacious. And that's an area where the research really needs to be looked at of, okay, if we're doing this program, how do we know it's working well? It sounds really great, but how do we know? And there's plenty of anecdotal evidence that really shows that it does, but in order to really change things on a national and a global scale, it needs to be more concrete. And that's where I think an area of research is important and where social workers can be very helpful.
I think each of the professions that you chose to talk about were really important in influencing many of the patients over the years that I've dealt with, and they've been great resources to ensure kids get to the right resource that are as necessary. The other thing you talked about that's very focused on Ohio is the Children's Vision Strike Force. Um, is that more advocacy work, and is that the primary purpose of that program?
Yes, so the Children's Vision Strike Force was introduced by Governor Mike DeWine during his State of the State address this past spring. I am not part of the strike force. I did get to attend their first meeting as just a public person, and they are going to meet again later this month. And it seems like, from my interpretation of the first meeting, is that it's really to listen to all of the different programs that are out there helping vision care access for children in some way, shape, or form, and then create a branched roadmap that a entity would be able to follow. And I think that unit of, is it a school, is it a health department, is kind of yet to be determined. But the goal is at the end of it to hand over a document that says, this is how you fund it, this is the roadmap, this is what people should decide based on their needs and community, and they can kind of take it from there, which is very cool.
So it sounds like both the Strike Force program on advocacy and the Real Eyes program for literacy education, those would be nice to be able to duplicate in other states. So thank you so much for sharing that information. Congratulations on your award. I really am quite impressed by what you're doing and what you plan on.